Any updates on a plan to resume visitations in the jail?
Your Honor, one of the things that we do at the Allegheny County Jails, we monitor the COVID cases in our community. And if you look at the COVID cases in our community, you still see that it is kind of high.
Do you sort of have in the back of your mind like a target date where you would like to see visitations in the jail resume in any form? It could be that you might decide that you don't want children right now because of that, but other family members may be able to visit. Or so do you have any kind of target date in your mind? And I guess the other thing is, have you sought any, I guess, guidance from the health department in how you could safely resume any form of visitations in the jail?
Yana, the target date is as soon as possible. As soon as we can see that these COVID cases in the community is reduced and it's kept at a steady reduction for a while, I would definitely talk to the health care department to see if it's safe to resume visitation.
Can we just segue then to the next thing about the review of the cell extraction policy?
So one of the things I want to report to the board is that in October, we had 4 uses of chemical agents in October. After December the 5th, we will not be able to utilize chemical agent. So therefore, a cell extraction team will have to be utilized to extract these individuals from the cells. So I'm just want the board to just be mindful when more inmates and more officers are hurt, it's because we cannot utilize chemical agent after December the 5th.
Thank you. Any questions?
I'm sorry, Judge Clark, I have a question about that. Is the warden telling us that because they cannot use chemical agents that people are going to be hurt? Is that what he's saying right now, or did I misinterpret that?
Saying, and I think we heard when we had the meeting with Seesaw, and the information that I got from then Secretary Wetzel is that without the ability to use pepper spray and shackles in a cell extraction, I can tell you Secretary Wetzel basically said he can guarantee more people will be injured because it's a volatile situation. And so if they can't get someone to de-escalate with words and they have to go in and they don't have the sort of the less lethal types of methods to extract or to stop someone, more people, because if you can't shackle, people can be kicked. If you can't spray, I mean, the thing is they're going to have to send a team of people in to physically take someone out of a cell if that person is a danger to himself or others. And so that's what they're going to have to do. I think that's what the warden is saying. That,
yeah, I just very much did not appreciate the way that was said. It came across as a threat. Is there a plan to inform the incarcerated people of these new policies? Is there a way to give them a way to report any violations of the referendum ban? What exactly is the jail doing to prepare for this? I understand that there are obstacles and you go over the obstacles multiple times, but can you go over exactly what you have done to prepare for the referendum's implementation and what it's going to look like on December 1st?
I'm not going to get into everything that we're doing to prepare for the referendum, Ms. Hallam, because that's going to violate some safety issues at our facility. But what I will say is this. We are preparing to train more correction officers to do cell extraction. We have not put out to the inmate population as to what can be done and what will not be done. And we will not do that because I feel as though that if they know that, then that could cause more issues after December the 5th. So I don't know what else you would like for me to report on.
I would like to know, after the previous contract was ended, what new steps you have taken to be sure that you're able to comply. I understand you're doing cell extractions, trainings. What do those look like? Who is conducting them? Who is receiving the training? Is that all that you're doing to prepare for this? Do you have also all the administrative aspects in place for the reporting requirements as well?
We have all of the administrative processes in place for the reporting, but of course that's changing, quite frequently. As I stated, we're preparing to train more correction officers in cell extraction, and we have certified correction officers here that can teach that training, man.
Okay, but what about specifically about the solitary confinement aspect of it, about that being banned? Do you have procedures in place to let the incarcerated people know? I don't see how that could be a security concern, to let them know that they are not permitted to be held in their cells and exceed a certain amount of hours a day without a certain amount of rec time, those sort of things. Is there a way to let them know, and will there be a reporting mechanism if they believe that the referendum's requirements for a solitary ban, to understand their rights?
So the incarcerated individuals have multiple ways in which they can report any violation. So they have the electronic tablets where they can do the request, the paper complaints. So they have the reporting system. I'm sure that they already know that they can, after December the 5th, that segregated individuals must be provided more than 4 hours of out of cell time. So I know they already know that already. So I don't have to do that announcement because they know. Secondly, the last thing I want to say is we are getting prepared by building more recreational areas so we can provide incarcerated individuals more out of cell time. So I think that we will be ready on December the 5th.
Operating under an assumption that there's that many people that may not have a vaccine come 1 month from today, what is the jail's plan?
Okay, we do have a plan. I'm not going to discuss that plan in this setting, but we do have a plan.
Okay, can we hear general statements about the plan? This is the Jail Oversight Board. I do think it's pertinent that we have the plan for a mass exodus of jail staff members. I think it's important.
Ms. Hallam, I'm not going to jeopardize the safety of this facility. If the board wants to talk to me one-on-one, we can talk, but I'm not going to do it in this setting.
Warden, can we do it after this meeting in an executive session?
Absolutely, we can.
All right, we'll do that then. Thank you. What progress has ACJ made in renegotiating the commissary prices with Summit so that individuals are not charged exorbitant prices for hygienic and sanitary items which are necessary to prevent the spread of COVID?
Yeah, and I think we took care of this months ago. We came up and we discussed with Summit. The Summit prices are final as of this time, and we will not be able to renegotiate the prices until the next contract.
So are they different than what was reported at a few meetings ago? I know that Mr. Korinsky had done a report on the prices and did some comparison with prices other places. Are those the same prices, or have they changed any? Because there was some concern about some of the prices being really high.
And you're right, Your Honor, and those prices are still in effect, and we're not going to be able to change those prices until the next contract.
Can maybe between now and the next meeting, I'm not sure that that's accurate, but because I think there are some legal issues with the prices, could you check with the solicitor and see if anything can be done before the next contract so that at least the prices are in compliance with the law?
I could do that, Your Honor.
All right. And so then we'll get a report on that at the next meeting. Currently, the jail is consolidating housing pods in response to staffing shortages. For example, 8D, which is a maximum pod, is being combined with 4C, an intake pod. This is dangerous because increasing the pod's population prevents incarcerated people from being able to socially distance safely. It also is dangerous because it mixes people of different classification levels, meaning a person charged with first-degree murder is on the same pod as people charged with much less serious offenses. Are there other options available to address the staffing shortages that doesn't risk the lives of incarcerated individuals and staff?
So a lot of this comment is inaccurate. Our classification procedures and the management of the population meet all safety guidelines. So we feel as though that we're meeting all of the safety guidelines when it comes to managing the population at our jail.
Ms. Hallam?
Yes, so going off of that comment, are pods being consolidated right now?
Pods are being collapsed, and we're collapsing pods based on classification and best practices. So yes,
Okay, and are each folks on the pods, especially now that they're being collapsed, is anyone on the same pod as someone with a different classification as them?
I'm just going to say this because I'm not going to get into that in this forum. We follow all of our classification procedures, Ms. Howell.
Okay, and why are pods being collapsed right now?
I'm not going to get into that in this forum, Ms. Howell. We can talk about that later.
Okay, why not?
The management of the population is our prerogative. That is something that we have discussed. And I think the warden has said on more than one occasion that it's not appropriate to discuss in this forum, and it will not be. So the response isn't going to change no matter how many times you ask.
Since April 2020, 10 people have died who have been incarcerated at the jail. And he names them all. Well, he doesn't name them all. Cody Still, Justin Brady, Binkley Harris, and John Brady all died after being at the jail for only a short period of time. ACJ has the responsibility to provide emergent care when someone walks through the doors of the jail. In addition, police, paramedics, and the courts also have a responsibility for the well-being of individuals before they arrive at the jail. These deaths were very possibly preventable. I am asking the county executive and the jail oversight board to form a task force of subject matter experts in the field of law enforcement, emergency medical services, opioid and mental health services, and county jail administration to develop best practices for these instances. So I don't know whether you want to, well, I'm going to ask Warden if you have any response for that. I would say that there are some things that are happening, including the RFP for the jail redesign project that would possibly cover some of these things. And also, I think Ms. Dalton has given some other presentations on sort of crisis response and things like that, which would help as well. But I don't know if you want to say anything. And then I can ask the board whether they want to do anything in response to Mr. Kensewitz's questions or comment. Yeah. It's really not a question, it's a comment.
Yeah, I don't have a response for this.
All right.
I don't.
Malcolm Durridge says, in a recent interview, Susan McCampbell of the Center for Innovative Public Policies says that she wasn't aware of any jail in the whole country. I guess this is sort of the same thing, but I'll read it just because it is sort of the same question. In any jail in the whole country that has been operating as restrictively as ACJ throughout the pandemic. In PA, most detention facilities are no longer in lockdown, and York, Lancaster, and Dauphin County jails are again allowing in-person visits again. The entire country has a hard time dealing with COVID and with staffing shortages, but only ACJ has been on 23-1 lockdown for the entire pandemic. Why does ACJ have this problem? Ms. Hallam, did you want to say something?
Yeah, I just wanted to read, citing the same person who the person from the public commenter cited. That quote was from Susan McCampbell. She's the president of the Center for Innovative Public Policy, and there was an article where she was quoted. I just wanted to add on it because something else she said I think is very important, and I would like a response to. She said that any facility that has 100% of their incarcerated individuals locked down 23 hours a day, there's something really, really wrong with it. If the COVID epidemic has overcome them, that means that the Allegheny County Jail, has very poor health care. There are issues with incarcerated folks' supervision, staff hiring, and staff training. So has the jail done anything differently since the lockdown started in regards to staff hiring, staff training, or healthcare at the jail to try to stop this lockdown from happening? Because it truly does seem, based off my research, based off talking to experts in the field, that Allegheny County Jail truly is an outlier in this situation.
I think that it's very convenient for somebody who's not seen our setting to make such blatant comments about the healthcare department. I'm devastated that anybody would just so willingly say things that are totally disrespectful to the hardworking people who have been in this institution fighting during a pandemic, during staffing shortages, but everybody's entitled to their opinion. I just want to focus on that as an opinion of a person and not fact. I would also state that it's important to remember that our case counts, though they have definitely at times been higher than they were in the early months of the pandemic, as an institution, we have had some of the lowest case counts despite having thousands of people come in and out of our facility. So our COVID mitigation measures have been effective for the population, and we do have an obligation to keep them safe. We have struggled with vaccination rates, which I will be providing those numbers. Despite continuous vaccination, we can't meet 50% because of the transient nature of our population. So I think it's easy to look at numbers. I think it's easy to just say jails this, prisons that, but it is not indicative of what is actually going on in this institution. And I feel like every single employee here would expect the respect and dignity to understand that they are working very hard.
I think my question was misinterpreted. It was not directed at all to the healthcare workers at the jail, but instead the administration who is responsible for the policies of the jail. Really, I just want to know if the issues that we're experiencing are ones that, according to you, are being experienced by all other jails in regards to staffing shortages and those kind of things. How come we're the only one who's still on 23-and-1? How come we're the only ones who still aren't having visits? How come we are the outlier in the situation? I understand, again, all of the problems that we're dealing with, but those are not problems that are unique to Allegheny County or the Allegheny County Jail. So why is it that we're in this situation? If you could please just answer that question. What is different?
I'm gonna answer this. I'm gonna answer this again, Ms. Howland. We had one COVID-related death. Look at other jails our size and how many deaths that they had. It's because of this administration and the employees and what they've done. So that's the answer to your question. What we've done works. It saved lives.
That is not an answer to my question, because I also read the same article that you're referencing about the Philly jail, and I'm wondering why the other jails who also have not had COVID deaths, who also are back resuming visits, who also are done with the 23-and-1.
So Ms. Hallam, it was an answer to your question. It was not an answer that you want. And it's okay that we have a disagreement here. We do that frequently.
15 employees will be scheduled for mental health first aid training on November the 9th. 12 employees is scheduled for de-escalation training that will take place on 11/22 and 11/23.
Does anyone have any questions? Ms. Klein?
Gordon, can you tell me, will there be someone on all shifts who have had this special de-escalation training?
I'm really trying to do that, Ms. Klein. I'm really trying.
Appreciate that.